Welcome back to section 2 of blood transfusion module. In this section, we will be going to discuss about pre, intra and post procedural steps of blood transfusion. So, let us start with the pre-procedural steps. First of all, identify patient to prevent errors and thus eliminates possibility of transfusion reactions. Check physician's orders, patient condition and history of transfusion or infusion reactions, reason for present transfusion, to obtain specific data and initiate patient education if required. Check availability of blood with blood bank. Explain the procedure to the patient, need for transfusion, blood product to be given, approximate length of time, desired outcome, etc. to provide reassurance and facilitates cooperation. Obtain informed consent from patient. Prior to administration of blood, the patient's vital sign should be recorded correctly to provide a baseline for further observation.
Delay the transfusion if temperature is more than 101.8 degree Fahrenheit.
Offer a bedpan before starting the procedure. If necessary, collect urine sample. The patient will have to lie down for few hours after starting the transfusion. Urine specimen collected before transfusion will serve as a baseline data to identify transfusion reactions if it occurs. Emphasize the need for patient to report unusual symptoms immediately, that is chills, headache, itching or rash. Early identification of transfusion reaction aids in instituting prompt corrective measures. Prepare infusion site. Select a large vein that allows patient some degree of mobility. Insert IV cannula, that is 18 gauge. Now, moving further with the intra-procedural steps. Obtain blood from blood bank in accordance with agency policy. If transfusion cannot begin immediately, return product to blood bank. Blood which is out of refrigerator for more than 30 minutes above 10 degree centigrade cannot be reissued. Never store blood in unauthorized area like ward, refrigerator. Blood must be stored in refrigerated unit at carefully controlled temperature, that is 4 degree Celsius. Faulty techniques in storing blood product can cause hemolysis. Assist patient in gain comfortable position to ensure comfort to the patient. Ensure privacy by having a bedside screen. Wash and dry hands. Prevent cross infection. Wear disposable gloves.
The doctor will cross-check the details on the blood bag to ensure right product is given to the right patient. The doctor and the nurse will inspect the blood product for identification number, blood group and type, expiry date, compatibility, patient name, abnormal color, clots, excess air, etc.
Safe storage of blood is limited to 35 days before erythrocytes are damaged. Verify that ABO group, RH type, unit number, patient's name, etc. matches. This reduces the chances of mismatched transfusion and transfusion reactions. Is warming of blood right? There is no evidence that warming blood is beneficial to the patient when transfusion is slow. However, keeping the patient warm is probably more important than warming the blood. Blood should be warmed in a blood warmer. Blood warmers should have a visible thermometer and an audible warning alarm and should be properly maintained. Blood should never be warmed in a bowl of hot water, as This could lead to hemolysis of the red cells, which could be life-threatening when transfused. Insert spike into blood container. Priming of tubing is essential for preventing hemolysis. Start infusion of blood product slowly at the rate of 2 ml per minute.
Remain with patient for first 15 minutes. Check vital signs for 1 hour in every 15 minutes and then every 30 minutes.
Transfusion reactions typically occur during this period. A slow volume can minimize the volume of RBCs transfused. Monitoring vital signs frequently helps in early identification of complications. Increase infusion rate if no adverse reaction are noticed. The flow rate should be within safe limits. Signs of a severe transfusion reaction, that is acute hemolytic anaphylactic, are usually manifested during infusion of the initial 50 to 100 ml. Flow rate is determined by physician's instruction and patient's condition.
If an adverse reaction is observed, stop the transfusion and administer saline or as per physician order.
Send urine sample, blood sample and remaining blood product in container with transfusion set back to the blood bank. Taking urine sample and blood sample helps in confirming transfusion reactions and comparison from baseline data. Administer medication prescribed for adverse reaction. Now, move on to the post-procedural steps. Dispose blood product container and set in appropriate receptacle as per BMW policy of the hospital. Wash hands to prevent infection. Record the following: product and volume transfused, identification number and blood group, time of administration started and completed, and signature of nursing staff carrying out procedure and patient condition. If agency policy requires, remove label from blood and paste it on patient's record. Assist patient to comfortable position. Is pre-medication shall be administered before blood transfusion? It is generally not recommended to routinely use pre-medication like antihistamines, steroids or other medication before transfusion. This practice may mask or delay the signs and symptoms of an acute transfusion reaction. What is the rationale behind starting the blood transfusion slowly? Options are: option A, minimize the volume of RBCs transfused; option B, early identification of complications; option C, prevention of hemolysis; option D, reduces chances of mismatched transfusion and transfusion reactions. The correct answer is option A, minimize the volume of RBCs transfused. Now, let's summarize the module. In this module, we have learnt about definition of blood transfusion, principles of blood transfusion, components of blood, articles required for blood transfusion, purposes of blood transfusion, special points while transfusing the blood, nursing responsibilities while receiving the blood from blood bank, and procedure of blood transfusion. I hope you understood the module and able to apply the knowledge in your clinical setting. Thank you.